I'm Scioscia, and I'm the Interim Executive Director for Student Health and Wellbeing. I want to take a few minutes to share with you our plans for the fall quarter in light of the pandemic that is facing the country and the world. And we're going to review the biology of COVID-19 as well as the campus-specific plan. So first, I'd like to start talking a little bit about this virus. We haven't known about this virus for very long. We continue to learn more and more about this virus, its characteristics, lots of things that are helping us formulate a plan that is based on science and that is, I believe, very thoughtful to maximize our opportunity for a safe campus. SARS-CoV-2 is the novel coronavirus that causes the disease, COVID-19. It can present in many ways. When we first started to see the virus, we saw a pattern of symptoms of fever, cough, and shortness of breath. Over time, we have found that this virus can present in many other ways with many other symptoms. It can present with a very unique symptom of losing your taste of smell or taste. We don't know of another virus that does that one, but it can also present with something very subtle, like nausea, vomiting, fatigue, a headache, symptoms that happen very frequently. So what's important to realize is that there are many ways this virus can present. Another unique feature of this virus is asymptomatic presentation. That means you may actually have acquired the virus and not have any symptoms. You may, in fact, be shedding the virus and at risk of exposing others to an infection and not even be aware of it. So asymptomatic shedding is a unique challenge with this virus. And it happens more frequently in younger adults. Our campus community is an example of a lot of young adults who might accidentally have acquired this virus and not have any symptoms. So in our planning, we have to account for asymptomatic shedding of the virus. So how can you become infected? This virus tends to move between humans through aerosolization of viral particles or droplets. Those are created from your talking, coughing, sneezing. The virus lives in your respiratory tract, your lungs. It also can be in your GI tract, and so it's excreted in feces. And we'll talk about why that's helpful for us as another signal for virus on the campus. So when we cough or sneeze, if we don't cover our cough, if we don't wear a mask, we could be shedding virus into the area around us. Now that virus doesn't travel huge distances. It tends to fall out of the atmosphere, right? And it dissipates, and it doesn't really cause problems way far away, which is why distancing becomes so important. So now understanding how this virus is transmitted is important for the protective measures each of us has to take to reduce the risk of the virus moving from person to person. So it's human behaviors, human-human transmission for this virus. So our strategy, we've been working hard for the last few months, taking advantage of the science. We're really blessed to have so many bright scientific minds. We have access to some of the best research in the world, and we've been using that to come up with a plan. Our plan has three core elements. It's the reduction of virus, detecting the virus, and caring for individuals who may have acquired the virus. So how do we reduce the presence of virus on campus? Well, we start out with some very basics. We have fewer people on campus. We are going to have classrooms that could have held a much larger number of students, have fewer students within them. They will all be spaced out. We're using marking and separation in other areas on campus so people can maintain that distance, that spacing and separation, which is so important. We've placed hand sanitizer stations in all kinds of locations because it's really important that you wash your hands to get rid of any virus you accidentally picked up from a surface. So having hand sanitizers all over campus, really important. So we want to reduce the presence of virus that way, and we want to detect virus. This is super important. So testing. We've heard a lot about testing and the challenges around the country. We are blessed in that we have access to testing, accurate testing, and rapid result testing. So we are taking advantage of that testing in many ways. The nice thing is, too, we are doing that at no cost to our community, our students, our faculty, our staff. We're doing the testing, making it very available. So there are a couple ways you want to have testing. Now, you need testing if you have any of the symptoms. Okay? You need testing if you've been exposed to someone who has the virus or someone in your family that you're living with, your household that you live with has the virus. That's called exposure testing. We also want to think about that asymptomatic shedding. That's asymptomatic or community screening. We'll also be checking into the waste streams of our buildings to see if someone is accidentally shedding virus without their awareness. So we're going to test in a variety of ways. One of the core ways we're going to be able to do the symptom testing is by participation in the daily symptom screener. Many of you, I hope, have already enrolled. Our employees and our students have already started doing this. And every day, you're going to get an email reminder to do your screening. You'll answer 3 questions. You'll be asked, where are you today? Are you going to be on the campus? Are you going to be working remotely in San Diego or studying remotely in San Diego? Are you going to be further away? If you're further away and you have symptoms, we're going to ask you to get care locally. But if you're in San Diego, we want to take care of you here, and you will get a call from the COVID testing line. You'll get a red thumb. You had some symptoms. We want you to come in for a test. You'll be able to self-schedule your test as a student through your My Student chart. We have a lot of locations to test, including one right here at the Price Center. So testing if you have symptoms. Another question you'll be asked is, have you been exposed? Has someone in your household tested positive for COVID-19? We also want you to get instructions there because we don't want you to come onto campus. We want you to stay in your residential space. If you're living on campus, we want you to stay put until you can get evaluated and good instructions. Because another thing about this virus is you may be exposed today, but your symptoms may take a while, up to 14 days. And in fact, from exposed today, it's a period that could be 14 days where you may be asymptomatically acquiring the virus and shedding. So after exposure, there's a long window of time that has to elapse before we can be confident that you've not acquired the infection from exposure. So when you answer the questions on the screener that you may have been exposed or someone in your household has tested positive, you'll get a yellow thumb. That thumb will lead you to instructions and recommendations about testing. If you say no symptoms, no exposure, everything's looking good, you're going to get a green thumb. That means you're good to go. You can move around in campus wearing your mask, of course, with freedom. You're in good space. So remember, the daily symptom screener is important for one, telling you what things you need to do for yourself, also whether or not you should have testing, and if you're in a good space to be moving around and engaging with campus activities. So in this plan, what do we need specifically from our students? First of all, we are going to ask students, it's going to be required that you test regularly for this virus. We're going to ask you to test at least twice a month, no fewer than 12 days apart, and no more than 16 days. Well, why are we asking this of students? It's because of that asymptomatic shedding, which is much more common in younger adults. And so the vulnerability that you could accidentally have acquired and be shedding this virus and infecting others is much greater amongst the student population than other populations. So we are going to ask folks to test on arrival to campus. And for the undergraduates, it will be a 2-stage testing. We're doing this to try and make sure that on campus we have identified any virus. If someone has accidentally arrived, we want to get them into isolation so that they don't spread it to others. So there will be testing. That testing will be ongoing throughout the fall quarter. And it's your participation in that testing that is so important, because we don't want to have a serious outbreak on campus. We don't want anyone to become ill. We certainly don't want our vulnerable students, and we have some with underlying medical conditions. We have groundskeepers with medical conditions. We have housing and dining folks. We have faculty. We have others. That this virus could be devastating. Now, even a healthy young person could be devastated by this virus. So we have to be very careful. So testing will be an important part of what you can do. And then you're going to move into some of the things that we all need to do as part of the campus community. We're all going to be doing the daily symptom screener. I do it first thing in the morning. I check in, I make sure. If I have a symptom, I get a test. I'm lucky I haven't had exposure, but it's a matter of time. I suspect some point it will happen. But doing that daily screener is a super useful tool. It also reassures you that you're in a good space if you haven't been exposed and you don't have symptoms. So do your daily screener. And if you need testing, we'll have it there for you. Second, when you leave your home, your residential unit, put your mask on. Wear your mask. You should have your mask on. Your colleagues should have their mask on. Your instructors should have their mask on. We need to all be wearing our masks. Because if I wear my mask and you wear your mask, if you're accidentally shedding, you'll be less likely to give it me. I'll be less likely to acquire it from you, and vice versa. If I'm accidentally shedding, I'm less likely to give it to you, and you're less likely to receive it from me. So dual masking is extremely effective in reducing the spread of this virus. Take advantage of distance. If you're further away from people, the viral particles have a less chance of being acquired. So one of the things is the outdoors. We have a beautiful campus. Take advantage of the distance and the space in the campus. If you want to meet with a friend and join each other for lunch, do it outside. Separate. You'll have to have your mask off to eat or drink, but put some distance between you, and it's a great chance to spend time together. So take advantage of this great campus and the space. So use distance as your friend. Pay attention to the markers. Wash your hands a lot. Remember to wash your hands when you touch surfaces. Wash your hands before you touch your face. Remember, the virus gets into your body through your mouth, your nose, your eyes. So if you happen to have acquired virus on your hands and you touch these areas, you will accidentally transfer virus and run the risk that you will acquire an infection. So remember to wash your hands before you touch your face and before you eat. It's really important. Another thing about eating, don't share that wonderful sandwich that you said, it was just great. I'd love you to have this. This is not the time to share food. Be careful to not share cups or cans or utensils, because that is another way to transmit the virus. So food is a very social thing that we love to do. But at this time, let's make sure that we're a little thoughtful about that social interaction of having meals together, put the distance between ourselves, and not share so much of the meal together. Another thing about this virus that I think we all need to keep in mind is we don't fully understand long-term complications or sequelae from having acquired this virus. And more information will be coming out. And for some individuals, even recovery may not be the end of the virus in terms of implication for their long-term health. And it's going to take a long time before we fully understand this virus. So we need to be careful. All of us need to be careful, because recovery may not be as simple as you think of recovering from the chickenpox or the measles. You're through it, it's over with, you don't have to think about it again. This virus is a very odd actor. And so we have to plan and behave with that in mind. So these are simple things. If you do it every day, they work. We know they work. There are a lot of folks that are a little bit dubious that young adults will not follow these instructions. I think there are equally as many people who firmly believe in the great community of students we have here. We believe in their ability to understand science, their commitment to each other, and their caring for each other. And I think they will accept, I am hoping you will accept each of us. And that includes not just the students, it is the entire campus community. Each of us accepts our responsibility to care for each other, because we think it is so important to be together, to have a chance to learn together, to do some of that learning in person with safeguards. So we have a great fall quarter ahead of us. Well, I think our plans are good. We are going to revise them. We'll still pay attention. We'll be looking for your input. We'll very much appreciate feedback and communication from you. And we'll keep you updated as things change over time, because with coronavirus and COVID-19, it's always changing, but we can adapt and we can do this together.